So today joining us in the Gyms Group podcast is Jade Rafferty, and you're one of our newest divisional franchisors. Now you're doing the Gyms Healthcare division, which is a very exciting division. Jim's pumped about it, and you've got a good business partner in Paul Comerford, who's founded JBI, which is Jim's Building Inspections, and obviously Jim's Hazmat as well, and got nearly, I think, 200 franchisees in total. So you've picked a really good business partner to come in. But I just want to talk about, this episode's about you and learning a little bit more about the division and yourself. So when people go to maybe, hopefully, make a decision to join you, they know a little bit about you before coming into the gym system. So first off, do you want to start with a little bit about yourself and why did you decide to join gyms?
Yeah, so I've got a 20-year background in public hospitals, private hospitals, and then into private practice. And I guess, I was speaking to Paul, it's almost 2 years ago now, about the gyms group and how it operates and the systems and the processes, and I thought it would be a really good fit with healthcare. We've seen a lot of frustrated healthcare workers, particularly post-COVID, who want to change, who want to control their time better, want to control, where they work, and how they do that. And, we think this is a great opportunity to put the gyms sort of brand and grouping together with their skill set.
It fits so well because we've got, already mowing franchisees, cleaning franchisees, laundry franchisees, doing a lot of NDIS stuff already, with plan managers and different things as well. And this is such a fit because I think those customers are already engaged with the gym system and like using our franchisees. This is just such a natural add-on, which I presume is why, you guys want to do this, just because of the opportunity that's already there.
Absolutely, yeah. So, as you're saying, gyms has great support from the NDIS through, particularly mowing, cleaning, dog wash, these sorts of divisions. Patients with and clients who have aged care packages as well.
Yeah.
And then there's also people who just need general help around and pay privately to have services around the house. And that can be anywhere from nursing, wound management, post-operative care, right through to transport, taking them up just to do the shopping, once a week. It might be something as simple as that.
Yeah, because I speak to a lot of our gyms mowing franchisees, and they have a lot of older clients as well, and they've formed really good relationships to them. And they talk to them about this sort of stuff as well, and about the problems and the frustrations they hear that they're having with other providers and stuff. And sometimes even the mowing franchisee will go and get stuff from the shop. So just to have this as available and as an option for people and for our franchisees to now recommend to their customers, it's such a win-win. And I think people looking at this compared to other ones, you've got this massive referral network already available with us, with people who actually want to use the services. I know even before you guys went live, there was a few posts that went online about Gyms Healthcare, and it was already people ringing up trying to become a franchisee or even get some work via you guys, even though it never even went live.
Yeah, absolutely. Yeah. So we've had probably the last 6 to 12 months, quite a lot of inquiries about becoming a franchisee,
which is amazing because you just literally started this month, so it's quite a good indication of how this thing's going to go.
Yeah, I mean we're only a couple of weeks in. We've literally just launched, and it's heartening for these people who are thinking about taking on a franchise and becoming a franchisee in a territory, generally close to home, and improving their life, improving their time management, being able to spend more time with their kids, their families, doing activities that they want to do, knowing that there's already work coming through, essentially.
What's the frustrating things then you're hearing from people who you've worked with over 20 years in the healthcare system? What are the things that they're frustrated with in the healthcare system that maybe something like this can address?
Yes, I think the large thing for us is people who are really motivated, who probably thought that running their own healthcare business was probably impossible, or just that the opportunities weren't there. Finally, there's really a good opportunity to do that. It's a national brand. Jim's already goes to people's homes. That's what Jim does. Jim goes to put up the antenna. He goes to wash the dog, whatever it might be. And so this is just an extension of that. And that's why I think it's a great fit.
Yeah, and even though it's Jim's, if you're a woman watching this, don't get put off by that. We have a lot of women franchisees in mowing, and actually our women, let's say, led divisions in terms of the franchisees that are coming there, like dog wash and laundry services, are our fastest growing divisions. So this one here, I predict, is going to be more women focused in regards to who maybe comes on with nurses and different backgrounds like that in regards to the healthcare profession. So it's a really good. Don't get put off by it just because it's Jim. Jim's the brand itself represents trust and reliability. Yeah. So that's hopefully something people take on board.
Yeah, correct. And I think that was one of the apprehensions of my business partner Paul at the start, coming from a building background, but coming from Jim's background, was how's this going to work? And I think that's why it works, is that the systems over 30 years that have been put together, the learnings that have been taken from making mistakes, franchising with call centres, with complaints and feedback, it's all been answered. And it's all been done before. And so I think it gives great confidence to the brand that the brand knows what it's doing, and it's just entering a huge market.
It's a great point, Jared, because there's a lot of Australia per capita has got the most franchises in the world. So it's around 1,400 brands. We're the most franchise-heavy country in the world, then it's New Zealand second, right? And so if you're investing in a franchise brand, you want to know, is that brand going to be around or is that going to stick, right? And I think with Jim's been around for 40 years, and as you said, tried and tested with thousands and thousands of successful franchisees and the systems in place. And when you're looking at other options, because there are other home care options available, you should take that into account. How long's the system been around for? What's actually behind the system and the brand as well? When you look at it objectively, even though we're not objective being Jim's, it's such a no-brainer to go with home or healthcare, or give you guys a call if you're looking at other options in this space.
Yeah, correct. And I think that that's important not only for the potential franchisees, but then also for the potential participants and clients who want something that they can trust. There's a call centre here in Melbourne. It's in Mooroolbark where we are today, and it's real. It's not overseas. You can talk to someone who can put you through to a franchisee and help you straight away.
It's a great point. So we'll just outline that for people as well, that we do have a call centre and franchisees can get leads transferred directly to them. So you can literally have a customer call up and speak to the franchisee directly within 15, 30 seconds.
Absolutely. And then that is likely to be either the franchisee that provides the service to you directly or one of their employees.
Yeah, because a frustration for a lot of people would be not getting onto a service provider, or you put an inquiry through and you don't get a call back or something like that. And with Jim's, you will get through to the franchisee. And that's, I think, is a really important thing for customers. And now let's touch on real quickly, Jared, the services that are available under healthcare, because it's a big, broad divisional name. What can franchisees do in it, or what ways can they go under their healthcare brand?
Yeah, so our our initial rollout is around support workers. So that will be help around the home. It might be helping with the washing. It might be some meal preparation, and then it may be community engagement. So taking someone to an event, to the movies, or just to go and do the shopping. Another aspect of this initial rollout is around nursing. So that might be wound management, post-operative care, ongoing nursing services, and then also allied health. So occupational therapists, physiotherapists. Is where we're starting.
Yeah, it's such a better service because you don't have to go to the hospital and wait and then go in there and come. Like with this, and easy for you, you just have someone come to your home with the trusted brand. The person who comes to your home is vetted by us as well, police checked, live, all the insurances in place, and you've got the backing of the Jim's group as well if something's not going according to plan to come in. Yeah,
absolutely. The stats will show that it's an aging population. People are living with more illness and require these supports, and ultimately long term the option of building more and more nursing homes and aged care homes, they're very expensive to run, and so this is effectively where it's a booming market.
Well, yeah, it's in the best interest of people to get or governments to get people to get more treatment at home and to get more home care, so they don't go to the emergency department, or they don't have to go here to the doctors unnecessarily. They can have the option of you guys just to come to the home, make it really, really easy, and it's a win-win for everyone.
Absolutely, and it makes them more comfortable.
Yep.
Everyone wants to stay in their own home. No one wants to be away from home. No one wants to be stuck in a hospital, unnecessarily, or nursing home, aged care home. If they can be at home and be treated by our teams, far better.
Now, I'll give you a personal story because we have my fiance's got an older mum, and she has a bit of this care stuff going on, and we're very distrusting of the people. Like, what's this charge for? They just see her as a as a endless meal ticket, but then they're charging for this, this, and this, and this. And I think the bit of you guys being available, hopefully when you have one around your area, I'll be using you guys because I know there'll be transparency and accountability if something's not right.
Absolutely.
Whereas I don't think a lot of people who might have their parents with a plan management or whatever, and the child's looking at what's this and that, and there's no real recourse or transparency. You're a bit unsure about things. Whereas with this, I think there's going to be way more accountability to that and transparency about what's actually happening.
Yeah, for sure. And I guess that's the beauty of it. You're dealing with someone local. You're dealing with the franchisee directly. You're not dealing with a middle management or a company,
sure.
Or a representative of the company. You're dealing with the person direct who's giving you the care.
Yeah, that's a really good one. You cut out that middle person, because if you're dealing with, you want to change a plan, you have to go to this person, and then this person's different services, and they don't like all that sort of stuff. Whereas, as you said, the franchisee you're dealing with is the one who's going to be doing the whole thing.
Absolutely. They're committed to your care, or it's one of their employees, but you've always got that franchisee who you can go to.
Now, I think a really good target for you guys is obviously nurses. So nurses work absolute long hours, and sometimes they don't do the nicest patients, and then they're frustrated. They've got a young family, and their money's not paid to what they actually provide and value in the community. So Paul mentioned before about the potential earnings with this division. So maybe do you want to outline a bit about financially what could someone who's a nurse maybe wants to come across to this potentially do, or how could they build their business? Maybe sort of tell them a little bit about the opportunity in regards to financially that could be available.
Yeah, absolutely. So our home support rates start from $80 an hour, and there's an assessment done with the support worker to begin with. Nursing rates start around about $100 an hour, depending on what the care is that's required. And allied health can be anywhere from $100, $150 an hour to begin with. And there's always the initial assessments. The franchisees will often explain all the costs, the ongoing costs. So it's really upfront from the start.
Yeah, and just be able to earn that money in maybe, let's say you've got a young family or something as well, be able to earn more than what you're currently earning, but working maybe half the time. It's Absolutely. Just such a no-brainer.
Yeah, correct. And there's just that flexibility hours. So, if you've got young children and you want to work school hours, you can do so. You may want to share your territory with someone else, a colleague, so that you're able to do half a week. Some people might want to work weekends when the husband's or the wife's committed to working during the week. It gives them that flexibility. That's
a great point you just mentioned, and something we haven't touched on before. So someone, like let's say you might have two nurses who want to go half and half in it, could have one territory, and then as you said, maybe one does 3 days and one does 3 days including a Saturday. That they could work it that way and still make a pretty good money between them.
Absolutely. Okay. And it also gives them a bit of coverage for holidays, school holidays. If you want to take the family away, there's always someone to help them out. And
let's talk about now the fees, because obviously there's a big misconception with gyms and with franchising. Well, it's a common thing that people understand with franchising because they think percentage of revenue.
Yeah.
But we know that it's obviously not the case with gyms. So maybe you want to talk about the fee model with gyms and how it works.
Yeah, correct. So there's a startup package fee, which includes everything. It includes your car signage, includes your stationery, your uniforms. It promotes you from a social media perspective and also through our website. And then that also gives you access to our online platforms for patient management, for HR services. So all our compliance is done through there, which is really important. And all new franchisees will provide and sign on through the platform the compliance certificates.
Yep.
And also their care plans. So they'll do that all at the start with you. So the model compared to most other franchising organisations is a flat monthly fee. So the beauty of that is that you control your costs. You know what you're up for every month, and that includes a marketing fee as well. Yep. So you're getting local area promotion for yourself. And then in addition to that, there's the marketing from Jim's Group and also from Jim's Healthcare as well.
Yeah, it's a great point about the flat fee that we need to... I'll just talk about it a little bit more because I think it's a big misconception with gyms or with our franchises. People think, gym's going to take 30 to 40%. So just to be clear, it's a flat fee, and the person who, let's say, has a revenue of $150K or $1 million in gyms pays exactly the same fee. The only thing that changes, and that's the lead fee. So obviously there's lead fees you pay a lead fee for each lead, but other than that, you pay exactly the same fee. So someone, for example, in your division could maybe have a business where they have 10 staff working for them and pay literally the same fee as the sole trader who's just doing it for more lifestyle. Exactly the same thing.
Absolutely. And we'll see a combination of both. We'll see people who, as you say, want that lifestyle, want to work for themselves and have a small business that they run independently. And then we'll have others who really want to expand their business, enter other territories, bring on lots of clients, lots of employees. But as you say, it's a fixed fee. Yeah,
because you don't need to be that many clients to be busy, because as you said, you might have a couple of people who require full-time care, and that's your client base done. But as you said, you do have the option with gyms to build your business and put on staff and take on all that extra work if you want to do it in scale. And you don't pay anything extra to scale. There's no extra cost for that. If you do want to take on an extra territory, obviously there might be an extra cost with that. But regards to putting on people, there's no charges at all.
No, absolutely. And a lead fee that you might pay once, that could be a client for 5 or 10 years. And you may have a set hourly, might be a day a week that you spend with that person.
Yeah.
And what a great opportunity.
Now, what are the current problems that you see with the NDIS and what's been going on at the moment that you guys will hopefully be able to fix or improve? What are some current things?
Yeah, so look, there's a lot around over servicing, overcharging hours.
Yeah.
And that's just not us, and that's not what we want to be doing. We want to be honest with our clients, and really be engaged with the care that they want, fully upfront about all the costs. And I think it's a great aspect of what we're trying to do here is that you've got a local person delivering you the care consistently. You don't have people chopping and changing all the time, like shift work through. You might get through an agency or a company.
Yeah. So I think the delivering of the actual service that people have been charged for is a big thing. Like I know my mother-in-law pretty much like, you get charged this thing and you're thinking they didn't do anything. And there's, $110 they've taken off her package and
Correct.
You can't see what's been done for it, right? Whereas you're saying that's a big thing for you guys. And it has to be with the gym system because if someone suspects that, they can ring in and put in a complaint and then you guys have to deal with it.
Correct. And we'll follow up on all that. And that's, where we talk about breaching, which is nothing that we want to be able to do, but it's not something that we want to promote or have to make a habit of. But ultimately, we want to protect our participants, clients, any patients that come along, they're first and foremost for us.
Because it's a great point, because when I wanted to touch on that real quickly is if, let's say, with mother-in-law's things going on at the moment, I can go to the provider, but they're just being put there by someone else. And if I call the provider, who knows who do I get, and they just maybe don't take it seriously and just send someone else. So you don't have that. There's no real action or recourse. You can do it. You maybe then go through the hassle of changing to another thing, but that's more hassle, right? Whereas with gyms, as you said, if there is any issues with that sort of stuff, you guys have to deal with it, and then the franchisee is held to account. So we have that customer service standard really high. So I think that's going to be a really good benefit of gyms healthcare is if you engage you guys for a service and people don't think they're getting what's required or there is an issue, there is direct accountability, which is not hard to hold that person to account because you just make a complaint to the call center or whatever you need to do, and you guys will have to action it.
Absolutely. So, it all comes down to the franchisee. But then obviously the scale, and there's a chain of command which is pretty clear. If it can't be sorted out by the franchisee, it comes through the franchisor. And then ultimately, if it's still not resolved, it goes through the gym. And, as we know, that's a gym's daily activity is to wake up and jump on board and look through complaints.
That's true. Yep. But I was going to say, just as like, if you've got a parent who's using and you're not really sure what they're getting for their value for money, there's like, just change over to gyms. It's a no-brainer. I just think the accountability and the trust in an industry which hasn't got the best reputation at the moment with all the stories that are going on, I just think it's an absolute win-win for anyone looking at this from a consumer level and also from a franchisee level coming with that branded trust. And so, let's talk about it in the training. So people coming from already been doing this job for a long time, now they're going to do their own business, which can be quite scary. So maybe we can talk about how you train them and how do you help them through that process?
Yeah, so look, I think from our point of view is that we want people to have as much information as possible. So jump online, put a call through 131546 to the call centre, and then ultimately book yourself in for training. There's no obligation to come to training, to sign on once you're at training, but come out, listen to Jim, hear the other presenters, understand how franchising works, understand how to build your business, talk to other people who are in the same situation as you are, not only who already have a franchise, but also potentially looking at one, and just give yourself a chance.
Oh, yeah, that's a great point you said about the you don't have to sign before coming to training. I guarantee you, if you're looking at other systems, see if you can do their training without signing a contract. Not going to happen. So with gyms, as you said, we encourage you to come and see training first, and hopefully after that you then sign, but we don't require you to sign a contract. Whereas any other provider, if you're looking at, you will have to sign a contract before really learning anything of the nuts and bolts of how division works. Yeah,
correct. And then an extension of that is then you come to healthcare divisional training, which is another 3 days. And that really embeds about what we're trying to do, the communities and the individuals that we're trying to look after. And, from that, I think you'd be pretty confident in making a decision.
Now, in that divisional training, is that more when you go out? Because obviously they know how to do the work technically. Is it more just like, how we want you to deal with the customer, making sure they understand how the lead allocation system works, all that sort of stuff, or what's involved?
So it's all to do with the running of the business, so taking on leads. And then the next part of that is around billing, around using our IT platforms, about writing progress notes. So it's everything to make sure that you're fully confident to go out on day one and run your own business, see your own clients and patients and participants, and not have any hiccups. But I guess in addition to that, you do have our support. We'll talk to you, every day, every week from the start. And then as you become more comfortable, you'll only need to talk to us maybe once a month, once every couple of months as a check-in. And we're always there for advice.
Yeah, and that's a really good point. And I think another thing people should know is that you're coming into a division where the franchisor, the divisional franchisor, Paul, your business partner, has done it multiple times before.
Absolutely.
Which is a really good thing for confidence when you're coming into a new gym's division. Has this person built this before? And he's built the biggest building inspection franchise since 2011. So he's done it. So I think having that resources and having all that stuff that goes behind that available to you guys as well from a support system, I think it's a really important thing for people looking at this.
Yeah, it's something that's commonly mentioned in the building inspections office is that we've got 10 years of all their muck-ups and learnings that we've learnt off, and it saves us an enormous amount of time. It gives great confidence to the new franchisees because all the questions have been asked before, everything's been done before, the mistakes have been made and learnt from, and if you're wanting to buy into a franchise, this is the one to do.
So what's included in the franchise fee? So I know from doing a little bit more research with other brands, you guys are probably, I think, the lowest entry point in the market, or you probably are one of the lowest entry points. So someone pays that fee, what's included with it?
Yeah, so they'll get their car signage, they'll have their initial stationery, they'll have access to all our programs, our procedures, protocols, and HR platform, and that gives them confidence to go out straight away and just get stuck into the work.
Yeah, and I also think, obviously, the training's a part of that package. You've paid already for a lot of compliance stuff, which you've already, you've put a lot of money into that, so you've done all that sort of stuff as well. And I think just the lead gen as well, you get them from day one. And we should probably mention it about it as well, and I'll let you talk about it, is also included in that is the pay for work guarantee. Yeah. So maybe you want to just tell people who don't know about it outside of gyms, what is the pay for work guarantee and how does it help them when they start out?
Yeah, so the pay for work guarantee allows confidence to go out and initially build your business, and whilst it's slow, we'll guarantee you an income of $1,500 per week. So that's not free money. That involves them actually getting out there and visiting healthcare centres, visiting GP practices, building their name, social media posts, all that content, video content, like what we're doing here, out on the road to engage with clients and build up their practice. Yeah,
because I think people need to learn about the income guarantees. Every franchise advertises an income guarantee, and there's always a little asterisk around it, right? Yeah. It's not just, there's maybe free money, but that doesn't really help the franchisee. So when Jim created this, it's not just free money because it doesn't help anyone. Because when the free money is not there or it gets to a limit, you don't have a business still, right? Whereas with this, we're paying you to build your business. So stuff you should be doing anyway, we're paying you. If you do require it, if you don't make the pay for work level, we will top you up. But we're paying you to actually build your business. And then that helps you in the long run because once you get over the pay for work guarantee, and just to be clear as well, a lot of people actually don't need it. Even though we advertise it a lot,
that's right.
It's actually very rarely paid out. So, but it's there. So if people have got a mortgage or something like that, they've just got that confidence that I will make that certain level, and we're paying you to actually build and promote your business, which is a really unique thing compared to the other systems that advertise an income guarantee, because a lot of stipulations to it. Whereas with this one, is a really win-win because it gets them busy and gets the name out there. But if they do need that financial security, it can be provided as well.
Absolutely, and I think Paul talks about it with building inspections that. It's been there from day dot since he started building inspections over 10 years ago, and he's hardly ever had to pay it out. Just through the call centre, the branding, and the amount of leads that come through the call centre, it's very quickly that franchisees are busy and have plenty of work to do.
Well, there's already unserviced leads for you guys, which is amazing because this division's just we're in July now. I think we did it went live like a week ago or something like that, and even prior to that, you had unserviced leads and you had all this interest for recruitment already. So, which is such a good indication of how well this division is going to go once it starts getting the promotion behind it, what you guys are going to do. I just think it's such a good opportunity now for someone to just make that change and get in and get the pick of the territories before they get taken up.
Absolutely, yeah. So it's a great time to get in, at a low price point, effectively pick of the territories. But I think also an important point to add is that you don't just take work from your territory.
Yes.
You can take work from outside your territory, and initially. That's very useful. There'll be leads coming from all over the place, and what we call unserviced leads, which you'll be able to take from territories that sort of aren't purchased yet.
Yeah, let's outline that real quickly. So that's a really good point. So in gyms, you're not just restricted, even though you have your territory. Yeah. Like if you're the only franchisee there, you're not just restricted to those leads. You'd set your areas to be like a 30k radius. So I'm willing to go to this, and we call that all areas. And then you can take work from wherever you want, and then over time. You want to take as much work as you can, but over time you can then condense it to maybe be local or be territory only once you get your existing client base and only get leads in those areas, and also turn on and off the times you work. So if you only want to work, Monday to Wednesday and receive leads in that time, you can do that as well, plus with your areas. But I think, as you just said then, you can take work from anywhere. The whole territory concept's a bit unusual to people outside and think they're restricted, but you're not restricted in regards to what you do.
Absolutely. And even if those territories alongside you end up being purchased at a later date,
Yes.
if you've already got existing work coming from those territories, that all remains with you. So that work's never taken away from you.
And it's a great point, and people should remember that the more vehicles on the road doesn't mean less leads. From our experience, it generally means more leads. So the more Jim's healthcare vehicles, look at mowing. I think the story Jim says, the franchisees in Victoria said to him, "Oh, when are you going to stop selling?" This was when he had 100 mowing franchisees in Victoria, and said, "When are you going to stop selling franchises? There's too many franchisees, and now it's 2,200 franchisees, and it has, the Jim's Group has more than 200,000 unserviced leads every year. So we know that the more healthcare vehicles that are on the road in an area, the more work it's going to generate."
Yeah, absolutely. I mean, we've seen an exodus of nurses from the hospital system, but the work doesn't go away. And, the home care work is massive. And same alongside with the support work through aged care packages, through NDIS. There's a plentiful amount of work out there. We just need franchisees to come on board and get stuck in.
But now they've got an option that's actually probably within their price range. Because I know the other options, I've done my research about the price range, and they're quite expensive. Like, it's not something that you can just pull out of the thin air for some of the six-figure for a home care for some other rival brands. Whereas with this one, with your pricing, I think it's a really fair, and it's probably the cheapest on the market that I can tell for people to get into.
Yeah, look, from what we've seen in our research, that's what we found, that we're not only with the at the lowest price point, but also we have the pay for work guarantee. So there's a guaranteed income from the start. So if you've got a young family, everyone's got bills to pay, you're covered from the start. And also then obviously the ongoing set fees.
Yeah, it's a flat fee. Yeah, no percentage of revenue. Like, people need to, if you're looking between us and someone else, just look at the percentage of revenue that they take. This is a flat fee model, and it's the reason why probably Jim's is so big as what it is because we do have the flat fee model, and Jim's about franchisees first, and the divisionals are as well. Like, we could do percentage of revenue, and Jim would be triple worth his wealth, but it's not the way it works, and that's why the gym system is such a good one. And a lot of people who even exit the system still talk about the gym system being a good one 10 years later because of the fair model that it is.
Yeah, and I think from a healthcare worker's perspective, this is sort of unheard of. It doesn't happen. The opportunity to really grow your own business without having to have a bricks and mortar shop front like a physio practice, or nurses have never really had this opportunity where they can actually make the income, pay the set fee, and keep the profits.
And you're right. I still think it's still a new concept to Australia in regards to getting home care in your home. But I think it's such a no-brainer. Like, it's such a better experience for people. And I think once people become a little bit more aware about how easy it is and how affordable it actually can be compared to what they're doing, it's going to be a win-win long-term for people to get in now. As you said at the start, the demand for this is only going to grow. It's not going to go away.
Yeah, huge. And as Jim always talks about, the greatest part of being a franchisee is the lifestyle and being able to control your own time. And I think for the healthcare workers, where it's generally such a regimented, set-based, practice, where it's appointments or it's turning up at set times, this gives that flexibility and just makes life a bit easier.
Yeah, spot on. I was going to say then, Jared, is there anything else I haven't asked you before we finish up today, or if someone wants to learn more about becoming a franchisee, what's the best thing for them to do?
Yeah, so ultimately call 13546.
131546.
131546.
So we'll keep that in there.
You better fix that up. Look, there's plenty of information. So there's hello at jimshealthcare.com.au.
Yep. What's your website?
Fix this up. Yeah, so www.jimshealthcare.com.au. And then there's the email, hello@jimshealthcare.com.au. And the team will send you out everything. We've got appendixes, we've got brochures, plenty of pamphlets with all the information. That's where the best place to go.
Yeah, I would say to people, it doesn't hurt just to inquire. There's no obligation, and if you want to come to training, you can come to training and see what it's about. Not even signing a contract. I think it's a no-brainer. There's no harm in it, and I just think even though I'm biased because I work with gyms, but I did a bit of research looking at other models because my fiance is a nurse, and we're looking at having a family and what's their flexibility options, and I've been looking at this sort of stuff, and the entry point's lower. It's a far better brand. Your referral network is already far better, and the systems behind it in terms of the stability of the company, which is important, and the long-term prospects of Jim's Group in general. We've already got 5,500 franchisees. It's not going anywhere. No. And I think that's a really important thing for people who are looking at a franchise long-term about to take those things into account. So hopefully people inquire with you guys, 131-546, or head on the website, jimshealthcare.com.au. Thank you for joining us today, Jared. I know it's not easy sitting in the hot seat, and you're a quiet fella, so thanks for providing all the information to us. I think it's really good, and I think people, such a good one to invest. You've got yourself with the expertise in the healthcare profession, and then you've got Paul, which has got all the divisional franchising experience. It's such a good team that they're going to have access to.
Fantastic. Thanks
Awesome.
very much.
Thank you.